Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. The health department recently introduced a new Perinatal Nurse Support Program. This program provides support for pregnant and postpartum individuals affected by substance use. They work alongside families during pregnancy and early infancy, offering education, resources, care coordination, and encouragement. Today, we're joined by Kinsi Schreiner, Senior Public Health Nurse with the program, and Leigh Frost, who manages Maternal, Family, and Nutrition programs. Kinsi and Leigh, thank you both so much for joining us.
Thanks for having us.
Thank you. Happy to be here. To start, can you tell us about the Perinatal Nurse Support Program and the work that you do?
Yeah, the Perinatal Nurse Support Program connects pregnant and postpartum individuals affected by opioid and substance use disorder with their very own registered nurse, who provides personalized care and ongoing support through home visits. And these home visits are really individualized to what the family needs, so they look very different depending on where people are at in their journey.
And how did this program get started?
We used to have a program specifically with the Department of Human Services, a nurse that would support young families in their services, something that was really helpful in the community that we no longer had. Funding was a potential for us. I jumped right on it to apply for it. I thought this was a great opportunity to start something like this for this specific population. Another driving factor was just the wide misconception around substance use. Substance use is a symptom of a chronic disease, and that a lot of people don't view it that way. And so we want to be able to support that family. We see the need in the community, and we know that nurse home visiting is a great support, a long-term support for those families. It's such a critical period in their life, and so we're just very excited to be able to offer this service.
Can you tell us a little bit more about the need for this program here in Larimer County? What gaps in services does it fill?
Yeah, well, perinatal substance use is a major issue in Colorado as a whole. The data kind of makes it very clear. Unintentional drug overdose is the second leading cause of maternal death.
Wow.
And in between 2012 and 2018, there was a 98% increase in newborns exposed to opioids prenatally. At the local level, we're meeting with our partners, and they're telling us there's a lot of great work going on in the community to support these families, and they get the support prenatally. They are getting resources in the hospital, and our partners are telling us that support drops off after they go home, and they often wonder how those families are doing. Through plans of safe care that they're writing in some of these programs, we can help support those longer term and hope for those longer term better outcomes for these families. And what we're finding with our research is individuals actually face a higher risk of recurrence or relapse in kind of the latter half of the first year postpartum. So we want to step up and fill that exact gap.
Can you tell me a little bit more about that plan of safe care? What does that look like for individuals?
Yeah, a plan of safe care is basically a family-centered plan that promotes the safety and well-being of both the infant and the parent postpartum. And so it looks like a document, but it's more than that. It's a living plan that really provides coordinated care to support families and improve outcomes in the long term.
Who all is eligible to participate in this program?
Yes, so we're focusing on pregnant and postpartum people in Larimer County who have been affected by or even have a past history of substance use, particularly with the opioid use. Suicide and accidental overdose are two of the leading causes of maternal mortality here in Colorado. And so what's inspiring or motivating to us is those are preventable causes. And so we really feel like we can make a difference and have an effect on long-term outcomes through home visiting. We're finding it is hard to identify this population before they deliver. We're seeing a lot of people in the hospital, and that's okay. That's why we've decreased that barrier. We can roll up to 6 months postpartum, and we're able to support for that full year postpartum. We really want to be a safety net for families that don't qualify for some of our other perinatal programs. Your income is not a criteria. Your level of education is not a criteria. Whether it's your first baby or 10th baby, it doesn't matter. So again, we wanted to decrease those barriers so we could be a safety net for families that weren't captured by some of our other programs that support.
Should a PNSP client experience a miscarriage or infant loss, is this program still something that's available to them to support?
I love that you asked that question because that's what this first year is about, is having those questions and having those ideas and seeing the need, right? So I don't think it's something we had come across yet, but I would absolutely want to continue to support that family. And they would be eligible on consecutive pregnancies as well. So there wouldn't be any reason we wouldn't continue to support them. We also have other programs in our community that supports fetal loss, that we great partners that can even do a better job maybe than we could to support such a huge loss.
So, Kinsi, walk me through what a typical visit looks like for you when you're meeting with these families.
Yeah, it really depends on the family and what they find important to them at that point. But to give you some examples, during pregnancy, we might have conversations around connecting them with peer support. So for a lot of people, they find peer support to be a very important part of their recovery. So that's something we could try to get them going on early. Another thing that we might discuss is preparing for baby, right? Making sure that they have the items they need and the space prepared for after delivery. And then during that initial postpartum period, you really want to focus on how mom and baby are doing. We can do those things from a medical standpoint as nurses. So we might be checking a blood pressure and making sure mom's blood pressure is normal. We might be weighing baby and making sure that their weight is healthy for their growth. And then after that, as we get further into the first year, it's really important that we provide anticipatory guidance to what they're going to expect with their baby. So for instance, around 4 to 6 months, we might be discussing the introduction of solid foods. And we might discuss safe storage of substances, making sure that we're providing a safe environment for the baby. So it really depends on where the person is at and what they would like to focus on. But overall, we're connecting them with resources, promoting health and development in both mom and baby, learning about attachment and bonding, and ultimately trying to boost their self-esteem and their confidence, not only in their parenting, but also in their recovery.
So, what are some of the complexities or special considerations that providers and pregnant people navigate when addressing substance use disorders during the perinatal period? Is there anything that's unique about it?
Absolutely. Good question. It's an important piece of the puzzle. When someone's struggling with long-term substance use, it over time changes their brain chemistry. And these changes are called neuroadaptations, and they can affect stress, motivation, reward, these systems that kind of naturally happen in our brain. But if you think about if you're a parent, or maybe you can put yourself in the shoes of a parent for a moment, you think about a typical pattern of caregiving, right? Maybe it's 2 a.m. and you wake up to a baby crying. You're going to feel a spike of stress. And that's natural. That stress motivates you to get up out of bed and to go soothe the baby. Finally, after maybe you've changed a diaper or you've done a feeding, the baby calms down. And that parent or that caregiver feels a natural flood of a reward, right? If you think about oxytocin, right, otherwise known as the love hormone, it helps us feel good that we satisfied their need. Because substance use rewires these pathways, it impacts every single part of that caregiving loop. It makes a person much more vulnerable to the daily stresses that a caregiver experiences, and it might also kind of dull that internal motivation and reward system that we're used to experiencing, and that helps caregivers feel fulfilled. As nurses, we can break this down for parents and provide that education. We can provide a safe space to have conversations like these, which will decrease shame. And we can also help connect clients to the individual care that they need to be the best version of themselves. And so when someone is struggling with substance use, fill in the blank of the substance, and they also probably have a mental health concern, those things are risk factors. And as the risk factors increase, their chances of eventually using opioids or turning to that substance is relatively high. And so we want to keep that in mind when we get a referral. We're looking at the whole picture and we're really trying to discern whether this person would benefit from a service like this that will put those supports in place to hopefully prevent future opioid use, right? And support those that maybe have already experienced that in their past or present.
How does the Perinatal Nurse Support Program work with community partners here in Larimer County?
Yes, we're absolutely partnering. There's a lot of good work going on already in Larimer. So we are actively meeting and collaborating. We're interested in the work that they're doing. We're wondering what they've learned so far. We're trying to identify gaps that they're seeing and seeing how maybe we could help support that. We're trying to avoid duplication of services, of course, and meeting with a lot of our partners too, just to get our name out. It takes a while when you start a new program to build trust in the community, even with our partners and with our community that we're trying to serve.
You mentioned that the community had noticed a gap after new parents leave the hospital, and this program is filling that gap up to that first year. Do we work with any community partners to connect new families to resources after that first year?
That's a great question. There are a few. One that's within our own health department, which is awesome. We can definitely refer out after the first year concludes with us. And there is probably continued need too, as well, for people to have that support alongside them as the child grows. So it's yes, and I think there's room for improvement in that regard.
What are your goals for this first year of the program?
So this initial year is more about meeting with our community partners, learning the needs of our community and how we can most effectively serve them. Less of a priority on the number of families we're serving and more on how we can serve them, right? Because our goal is a generational effect. And so it's not a short-term game, it's a long-term game. So it may take us a little bit to get up and build that trust I was mentioning and get people even to know that we're offering this service. And we may not see effects right away. We may just be planting the seed today, and hopefully we will have a better outcome for this family.
One model we use to kind of guide the philosophy of the program is called the TRAINS theoretical model, also known as stages of change. And it basically assesses a person's readiness for behavior change and also kind of provides a guide to process them kind of through behavior change. And, really our goal is to not rush them along or push them from one stage to the next. It's more about meeting them exactly where they're at and matching our interventions and our support to line up with what their current stage of change is.
Yeah, so that comes up for me when you say, how many are you serving? Our bosses always want to know, how many are we serving? How much good are we doing in the program? But to Kinsi's point, not everyone's ready for this change, and our job is to be there when they are ready. And that may look different every year.
Are there other programs, either here in Colorado or around the world, that are similar to this one? And if so, what does data tell us about the outcomes or impacts for this type of program?
Yeah, there are some wonderful peer support programs, doulas, and treatment programs here in Larimer County. We aren't aware of any other nurse-led home visiting programs that can serve these families. We value the home visiting piece because we are able to meet them right where they're at. The clinics have a restriction of time, right? They see them for X amount of time and then they're out the door. And through nurse home visiting, we're able to be in the home, reduce those barriers of getting to a certain place and moving at their pace because we have more time.
Yeah. From a national perspective, there's data to show that home visiting specifically is really effective. So there's the My Hope study, which stands for Mother and Infant Home Visiting Program Evaluation. And they found that direct interactions between clients and home visitors has long-term positive impacts on families, such as better maternal mental health, reduced family conflict, strengthened interactions between parent and child, and even improved economic circumstances for families. So we feel very passionate about the home visiting piece and wanted that to be a pivotal part of our program.
So I do want to ask you both, what are you most excited about with this program? I know it's a new one, so there's a lot of potential, but is there anything that you guys are really looking forward to?
One of my favorite parts is just being able to get invited into someone's home, into someone's life, Learning from these families, I already feel like we are learning so much and really being present for them to share some of their story. I think there is an amazing opportunity to help them feel heard, which maybe they haven't in a long time.
Yes, and actually being able to work alongside these families and not have them just being identified by the substance use, right? We want to celebrate them as new parents and having a new family and a new start. It's a critical period when you're having a baby, a good time for change. Empower these families without the stigma, right? And they are new parents, and we're here to support you as your new parent role and you and your baby. We talk about it being a symptom of a chronic illness, and we wouldn't have expectations of someone, say they have diabetes and they get pregnant, that the diabetes just goes away. And in fact, we would probably support them more, right? To have them have a healthy pregnancy and healthy baby, even though they have diabetes. And so that excites me, that opportunity to be able to provide that extra support and care for these families in similar situations.
So, for somebody listening to this podcast or who hears about your program, how can they go about participating in it or learning more?
It's as easy as Googling. If you Google Larimer County Maternal Child Health, it pops right up. We're the Perinatal Nurse Support Program, which is one of the programs listed there. We have our own webpage to check out. And for an individual who's kind of intrigued, there is a program interest form. It's very short and sweet. They could fill it out and we would reach out so they can learn more.
And what if it's like a provider? They have a patient that they want to refer. Is that kind of the same process or is it a little different?
Yes, so I think the website is a great place to find information. We're also actively outreaching. We would love to come meet with you and talk about the program. We have materials that you can share with people you're serving and talk more about the program. So we do have a separate form for providers, but if they want to use the simple form, they can use that too.
Leanne, Kinsi, thank you both so much for joining us.
Thank you.
Thanks so much.
Do you have a question about public health in Larimer County or a topic you'd like us to discuss? Let us know. Email us at healthiertogether@larimer.org. Thanks for listening, Larimer County.
Until next week, stay well, stay connected, and remember, we really are healthier together.